Now we're going to discuss both postoperative and exertional ileus. Ileus is defined as a lack of coordinated motility without a physical obstruction. So nothing's moving through the GI tract, but there is no physical blockage. It's a functional obstruction. Things just aren't working right. In this picture, the intestines are very healthy. Some areas are more spasmodic, some are fairly relaxed. This would be a classic picture of ileus without any underlying enteritis. Postoperative ileus can affect all horses that have had surgery. Generally, it starts about 24 hours after a surgery, particularly when the small intestine is involved in the surgery. It's much less common if we've been doing a colon displacement, for instance, than if we've been doing a small intestinal manipulation. Clinical signs are colic, tachycardia, and reflux. So when your post-op case heart rate starts going up, the first thing you want to do is pass a tube. Post-exertional ileus tends to have, instead of previous colic surgery, previous high-level exertion. So they've been through a lot of exercise, they sweated a lot, they worked hard, they may have some heat issues, so it affects performance horses that have recently been working. Clinical signs include depression, high heart rate, reflux, dehydration, colic, and then electrolyte imbalances, including a high sodium and low chloride. Diagnosis is based on passing a stomach tube and then ruling out physical obstructions. Serum electrolytes can be particularly helpful in the exertional ileuses and in the post-op cases that may have problems with calcium or other electrolytes, and obviously history is key. It is important to rule out other causes such as a physical obstruction, maybe a strangulating lipoma or a tumor, or adhesions in your post-op colics, and then in the exercising animals to rule out heat exhaustion, myopathies, and then multi-organ failure due to exhausted horse syndrome. Complications include anything related to the reflux and distension, including gastric rupture, organ failure due to the electrolyte abnormalities, adhesions due to lack of motility. If you've just gone through colic surgery, your intestines tend to be a bit irritated, and if they're not moving, they'll stick together. And the negative energy balance, because these horses cannot take in any oral fluids or food. Prognosis for POI is good if they respond in a timely manner to your treatment or to Mother Nature's efforts, and post-exertional is good if they don't go into multi-organ failure and things like that. Treatment, basically these need to be referred. Any refluxing horse is going to be high maintenance, but before you send them, please pass the stomach tube. If they have heat issues, the body temperature should be lowered before they get in the trailer, and IV fluids can be really beneficial, particularly for the exhausted horses. Then be careful with the electrolytes. Treatment in hospital would be more IV fluids, careful monitoring and correction of electrolytes, acid-base balance, things like that, maintaining stomach decompression, monitoring organ failure, renal failure. It tends to be comorbidity with this syndrome, and then we usually give them some motility stimulants. Our favorite in this hospital is IV lidocaine, based upon some research that I actually did as a resident, showing that it helps return to function after horses that have been treated with it for up to 24 hours. Horses that are refluxing for longer periods of time probably need to be on some sort of parenteral nutrition if it can be afforded, and eventually some horses will be taken to surgery, where it seems that if we decompress the fluid, move it into the cecum, their intestines have a chance to rebound more quickly. Prevention for post-op ileus, we do use IV lidocaine as soon as they hit the stall to try to minimize the risk of developing it. During surgery, we try to minimize trauma to the bowel. You can see in this picture there's wet lap sponges, we've got wet gloves, we've got most of the intestine back in the belly. The light is directed off to the side so it's not overheating the bowel. And then when we finish, we try to decompress the intestine so there's not a lot of fluid sitting in there that needs to be moved through, but doing it very carefully and cautiously so as to provide more benefit than harm. For the exercising horses, proper conditioning is important. You don't want owners sending them out there for a major competition when they're out of shape. You need to avoid overheating. This horse has been body clipped. If you can get the neck and the torso as much as possible while protecting the areas where the saddle fits, that will help them with cooling. And then water and electrolytes. It may help to preload these horses with some oral electrolytes before they start exercising, and to ensure they've got access to water and electrolytes as they compete.